most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 3 miracle exercises for hip pain. We've been waiting a while for this book to come out. Do we get the book here?
Yeah, it's right behind you, Bob, on your left.
It's way over here. We're really ready for this video, aren't we?
Yeah. Well, it's a Tuesday.
Robin McKenzie is one of our favorite physical therapists. Actually, he's probably the most famous physical therapist in the world. He's now since passed.
Right.
But he has a lot of self-help books.
Right.
And he's always talked about the hip in some of his books, but he never did the self-help book for it. So he's got one for it. Yeah. McKenzie Method, Treat Your Own Hip. We'll have it linked down below. We're doing 3 videos this week on his book. And if you want to get the full synopsis that you can read, go ahead and get the book.
Right. And it's written for the layperson.
Yes, it is. Mm-hmm. It's written. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to our website, bobandbrad.com, and you'll find all sorts of goodies. But one thing you'll find if you go to the giveaway section, we're always giving something away.
Our mugs.
Yep, our ugly mugs are on a mug, or you can get Strong Like Bull.
Strong Like Bull.
And you can also get T-shirts and all that other crap. So,
wow, it's a lovely site.
Go to Facebook. And you'll find the same thing there pinned to the top of the page. If you want a short version of us, go to Twitter or Instagram, 20 seconds or 60 seconds of us a day. So 3 miracle exercises. I have used these exercises with other patients, and sometimes they work wonderfully. And
right.
They honestly, they take people who are in the grass, are just about ready to have hip surgery,
right,
and pull them away from it. And
yeah, so typically, these are these chronic hip pains. Oftentimes, it's not like necessarily from an accident. Say you fell down or broke your hip.
In fact, if you fell down or injured it, I wouldn't recommend these exercises.
Right. Or if you had hip replacement, these are not going to be for you.
And they're not for back pain either. I mean, if your back pain's going down your hip, and it's not for children or adolescents. It's just not effective.
Well, who is it for then, Bob?
It's for, again, the older person who's having pain. You might think it's due to arthritis. It might be due to arthritis. And you still do want to stretch it because quite often, rather than getting the pain from the joint itself, you might be getting from the structures around the joint.
Right.
They're all too
muscles,
tight.
The tissues, capsule, etc.
Yeah. And so by stretching out the hip, a lot of times the pain goes down. And again, I've seen this with myself, and I've seen it with others that I still am able to run at age 59, heading towards 60. I'm on the slope, Brad.
Slippery slope. Bob, it's almost 3 minutes. These people
want
to
start off. Number 1, there's only 3. So the first one is the hip flexor. We're stretching the hip flexors. I'm going to go this way, Brad.
Okay.
Just so you throw a pillow down.
This is the muscle in the front where your front pocket is. Right in there. It's deep.
Right there. Now what you're going to do, you're going to set up, put your knee on the soft pillow. You're going to lean forward like this, and you're going to take the hand here, and you can actually push it forward like this a little bit. But I also want to have you take that foot and put it out that way a little bit.
So if it's your right leg, it goes out towards the right.
Away from the body. If it's the left leg, it goes to the left, out, away from the body. And while you're in this position, keeping a good upright posture,
good
you're
tall body.
Pressure on, pressure off.
Do you do this stretch, Bob?
I do.
Yeah, you can tell because for 59 years old, that's a really good range of motion.
Right. Yeah.
Do you color your hair, Bob? He said no gray hair hardly.
I got that from my mom. My mom actually she laments about it. She wants to have gray hair. Oh. And she does have some now, but my mom is almost 90 years old.
Well, let's get on with the stretches.
Okay. So we're going to do this like, I'd say 10 times, 10 repetitions, 4 to 6 times a day.
So, really? So get after, for how long, though?
What do you mean, for how long?
For weeks, months?
Oh, I mean, until the pain starts going away.
Sure, yep.
And once the pain goes away, then you can do it probably once a day, just maintenance.
Maintenance, sure, okay. And that goes for all of these, correct?
This goes for all of these. 3 exercises, 10 times. It's going to take you, what, a couple of minutes?
Right.
And I realize, people are going to say, well, I can't do this 4 to 6 times a day. Well, then you're going to go in for hip surgery, and, you're going to have a major disruption to your life. And
Now, I do want to put the warning out. If this stretch does create pain, particularly sharp pain, that's a red flag. It means you're doing it too hard, or it may be a problem in your hip and you should not do it.
Right. We're looking at maybe a little bit of stretching pain, but nothing significant at all.
And as you do more, it should feel like it's loosening up and better.
A lot of people like the feeling of this one, Brad. In fact, if you get to the point where the pain is gone or manageable, you might only have to do this one. This is probably the main one that you have to do. Okay, the second one is you're going to stretch the hip into flexion. So I'm going to grab this one, Brad.
Right.
Okay, so all you got to do, you're in your chair, you can be at your office, you're going to stretch up, and again, pressure on, pressure off. You can do 10 repetitions. Now, if you really want to get to it, you can lean forward even like this, or lean back, I'm sorry.
Slide your buttocks
Slide your
forward.
butt forward, and then you can really give a good stretch to it.
And just relax and breathe while you do these. You know, it's one of those things that as you breathe and relax, things stretch much better.
It actually feels good. This is one I do not do.
No, you don't.
I don't know. I just felt like I've not needed to do it.
Yeah, and if that's the case, then you don't need to. But it does feel good.
Yeah, it does feel good. I'm kind of surprised. Maybe I'll start doing it. All right, the next one is, and I also perform this one, hip external rotation. You can do this on the floor, but again, easier to do in the chair. So you're going to put one foot across, you're going to put the ankle across the knee of the opposite,
like
and you're going to press down.
Not too hard.
Yeah. Pressure on, pressure off. Pressure on, pressure off.
I'll just show them how you can do it in bed.
Sure.
See how I can, it's the same thing except for you're laying down.
What I like about this one is you can actually compare sides really easy on this. We've done this before. So if I put the other one up and it's way up like this, obviously this one's a lot tighter. Than the other one. And again, pressure on, pressure off. Now this is the one I also do. I did it this morning. I do it every morning. I'm able to keep my hips in good condition so that I can keep running.
So I multitask with this one, but when I put my socks on the edge of the bed, then I do it because my foot's already there.
There you go.
And just a few stretches, put the socks on, stretch a little more, and go to the next one, and
that's a good point. Yeah. Make it a part of your day, and
exactly.
Then it's one thing. It's a reminder to do it then also.
Yeah.
But if you have a desk job and you're working, on a chair, obviously these two are so simple to do. These are easy to do 4 to 6 times a day because you just go like this.
Right.
I mean, people won't even around. You won't even notice.
Exactly. Or they might. Everyone in the whole office might be doing them.
Yeah, and if they notice, they go, "Oh, it's just that Heineck again. What's he doing now?"
Nutcase.
Yeah. Give those a try. Give us your feedback. Let us know if they work for you. Because we always we've seen them work with our patients.
Yeah.
But of course, they're not 100% effective, but they help a lot of people.
Yep, they certainly do. And they're simple. Again, don't overdo them. Take your time with them. And Bob, what else do we always say?
We can fix just about anything.
Except for
a broken heart.
There you go.
But we're working on it.
That was smooth, huh?
Yeah, really smooth.